Graphs. Oh my God. Many people react like this, and I've seen students struggling whenever there are graphs and the questions based on the graphs. Students tend to leave those questions. They think that this is a dreadful question and they just stay away. So I thought, why not add a new section on the channel, and therefore from this video we are starting a new section. That is, we will discuss all the graphs in physiology and medicine, starting with the simpler one today, and it's related to the transport of the substances. The graph is related to the transport mechanisms, and I'm sure this graph you must have seen it because it's there in the first or second chapter of the physiology. The graph is plotted for the concentration of the substance on one side of the membrane, plotted against rate of transport of that substance, how it increases or what happens to the rate of transport. The graph compares simple diffusion with carrier-mediated transports. Carrier-mediated transports are facilitated diffusion, as if the carrier facilitates that transport, so facilitated diffusion, or secondary active transport is also carrier-mediated. So this graph applies to simple diffusion versus facilitated diffusion or secondary active transport, but more precisely for facilitated. Let's see how the graph shapes up for us. Okay, so it says concentration of a substance was increased on one side of the membrane. 5 it could be an arbitrary unit, 5 millimoles per liter or something like that. So 5, 10, 50, 100, 500, 1000, 5000. We are increasing the concentration of the substance on one side of the membrane. Let's say like this. This is an alveolus and this is pulmonary blood. Now we are increasing the concentration of oxygen. Like for instance, we inspire atmospheric air which contains only 20% oxygen. Instead, we give oxygen by mask. Now this will be 100% oxygen, means 5 times higher concentration. So in the alveoli, the oxygen concentration will increase. So the graph is telling us when the concentration increases on one side of the membrane. In the case of simple diffusion, you can see the graph, it is rising almost to infinity. Increase the concentration on one side, the rate of transport is increasing in the corresponding fashion. That's what is telling us about the simple diffusion line. So oxygen will increase, its diffusion rate will increase from alveolus to the blood because its concentration had increased on one side, and the simple explanation is because you increase the concentration on one side, you are actually increasing the concentration gradient on across the membrane, and since concentration gradient is increasing, therefore the rate of transport will also increase. Rate of diffusion is proportional to the concentration gradient. All right. That was about the simple diffusion and its application in the clinical practice, giving 100% oxygen, how it is beneficial. Now coming to the carrier-mediated transports like facilitated diffusion. It is the carrier which is carrying the substance like a glucose or like a para-aminohippuric acid or inulin. So here is a carrier, and there is a particular substance on the outside and inside of the cell. You can see here concentration on one side is being increased. So initially 5 millimoles per liter and inside is 2. Therefore the substance will bind to the carrier and will be transported. If you increase the concentration on one side and make it 10, it still has the binding sites. So all 10 can bind. This is just a theoretical example, just for the sake of explanation, okay, at this point. So all 10 can be transported at once because it has the binding sites, and therefore the rate of transport will increase. But If you increase the concentration further to 50, let's say 50, now the carrier is getting saturated at this concentration only, because it means it can carry only 10 molecules at a time for that particular substance. So if you increase the concentration further, the rate of transport will not increase any further. The rate will be stabilized at what it is for 10:2. I mean, it can bind 10 at a time. These are arbitrary figures. So don't go into the units of that or whatever. Just think about the numbers right now. And these are indicative of the concentration, increasing concentration. And that's what's shown in the case of facilitated diffusion. Initially, the graph of facilitated diffusion rises steeply. So I want you to note one more point here. Look at the steepness of simple diffusion and compare this with facilitated diffusion or carrier-mediated transport. Up to a certain point, the carrier-mediated transport is faster compared to simple diffusion. All right, that's indicated from the steepness of this curve. But beyond a certain point, you can see here now, concentration was increased on one side, 5 to 10 to 50 to 100. At certain concentration, the carrier is getting saturated. Means that much will be the maximum rate of transport. Beyond that, it is not going up. So even if you increase the concentration further, make it 100 or 500 or 1000 on one side, but the rate of transport will be the same as that was achieved for 50, because those many are the limited binding sites on the carrier. So even if the concentration on one side is 100 or 500, it will carry only 50 at a time. That is the maximum rate of transport which is achieved here. So this is the point where the carrier was saturated, and then the rate will remain stagnant even if you increase the concentration. So that rate is also called as V max, probably velocity maximum. This is applicable for all the carrier-mediated transports. Like glucose, for example. If you increase the glucose concentration, if you eat more and more glucose, and it is going to be increasing in the blood, and from the blood, this increased concentration on one side, right? So its transport into the cell will also initially increase because of its transporters, the GLUTs. But beyond a certain concentration, the carrier will get saturated, and now the rate of glucose entry into the cells cannot increase any further. It will be same. Even if the concentration goes on increasing, the rate of transport into the cell cannot increase any further. It will become stagnant, which means what? Which means the glucose level in the blood will begin to rise. It is being pushed into the cell, but then at certain point, its rate of being pushed into the cells will remain constant, and since it's not going that fast, its level rises in the blood. Or I've taken one more example which was asked as an MCQ in one exam. MCQ was like this: para-amino hippuric acid was being injected in a patient to measure the renal plasma flow. You know, PAH clearance is equal to renal plasma flow. So PAH was being injected, but the technician made some wrong calculation, and by mistake he injected 3 times the dose that was given to be means a required dose was, let's say, X. By mistake, the technician gave 3 times this dose. So the question was, how will it affect the measurement of renal plasma flow by PAH clearance? Let's just understand this, and it will have the clarity on facilitated diffusion. Now the first thing is, the PAH transporters are present in the PCT, and there are organic acid secretory systems or organic acid transport mechanisms are present in the PCT. Normally, PAH, when it is injected, 20% of it gets filtered at the glomerulus and remaining 80% comes by secretion, and that means 100% PAH will come into the urine. Nothing will go in the renal vein. In fact, that is the quality of PAH for which we use PAH, right? Okay. Now imagine this, that twice the recommended dose of PAH was injected by mistake. You know what will happen? Twice the recommended dose, or by wrong calculation was given. That means, now listen to this part carefully, its plasma concentration will increase because you have injected the PAH into the plasma, into the blood, and therefore more and more PAH will now bind to these carriers, okay, and more will come by secretion into the urine. Still, all the 100% is coming into the urine in a single pass, okay. So what is happening? By mistake, when you gave twice the recommended dose, its plasma concentration increased, and therefore its urinary excretion rate also increases. You know the numerator is UX into V. So UX into V is total excreted amount into the urine. In the case of this PAH, if twice the recommended dose of PAH was injected by mistake, its plasma level will increase, but its urinary excretion rate will also increase. Why? Because you are increasing the PAH concentration on one side, that is in the blood, in the plasma. What is happening? More and more PAH is binding to the carrier, and its rate of transport is also increasing. You see, initially when you increase the concentration on one side, the rate of transport increases. Carrier can bind more molecules at a time and transport it. So rate of secretion and therefore the rate of excretion into the urine will also increase. Watch it. In numerator is rate of excretion into the urine, that will also increase. But by chance, by mistake, if you give 3 times the recommended dose, now what will happen? Now the carriers have got saturated in the PCT. So its plasma concentration is increasing because by mistake you gave 3 times the recommended dose, that went into the plasma, its plasma level is increasing, but its urinary excretion rate cannot increase any further because its rate of transport in the PCT, that is the rate of secretion into the PCT by these carriers, it cannot increase any further. Carrier got saturated. They can only secrete that much, not more than that. That means beyond a certain point, its urinary excretion rate, that is numerator, will come to a constant level. A constant amount will be excreted into the urine, whereas its plasma level has increased, and that means no change in the numerator, but denominator is increasing. That means the entire value will decrease, and therefore PAH clearance decreases means what? PAH clearance is equal to renal plasma flow. We take it as a renal plasma flow. So that means erroneously lower renal plasma flow will be measured. So just not only the graph, but its application also can be discussed in this manner. In this playlist in the channel, we will regularly post the graphs and their clinical applications and how to read those graphs, etc.